Hello everyone! In this video, we will talk about tuberculosis disease and some of the anti-tuberculosis drugs. Our group consists of 4 members. My name is Aina Sofia and the other members are Alia Arisha, Aisha Humaira and lastly Aisha Suraya. Let me start with the introduction of tuberculosis disease. For millennia, tuberculosis has killed a large number of individuals. This disease reached pandemic levels in Europe and North America throughout the late 18th century. Tuberculosis has earned the title Captain among the men of death since that epidemic. Tuberculosis or TB is an infectious illness that can be transmitted through the air. The lungs are the most commonly infected body area by this infectious disease. Bacterial pathogens are the infectious agents responsible for this condition. The bacteria that causes tuberculosis is a bacterium type known as Mycobacterium tuberculosis. It can be transmitted from person to person via minute droplets discharged into the air. TB is divided into 2 types. The first type is active TB disease. Active tuberculosis will occur when the TB germs multiply rapidly in the body. Not only that, the germs will infiltrate other organs of the body, not limited to the lungs only. Active TB can be categorized into 2 categories. The first one is pulmonary TB. It is an active TB in the lungs that is the most common TB disease condition usually heard by people. The second one is extrapulmonary TB. It is a condition where TB bacteria attack the outer parts of the lungs such as bones and abdomen. The second one is latent TB infection. People with this type of TB will not experience any symptoms, especially if they have a strong and healthy immune system. They will not spread the infection to others as the TB bacteria in their body are inactive.
TB is transmitted from the infected person to healthy person through the droplet nuclei that can remain suspended in the air for a long time. The transmission of these droplet nuclei can occur by inhalation of the same air, singing, talking, coughing, and sneezing. TB attacks the alveoli that located in the lungs. TB is recognized by the macrophages and signal various of cytokines and enzymes that attempts to kill the pathogens. Nevertheless, TB can block the action of macrophages, thus avoiding the phagocytosis, rendering it differentiate in the phagosome and forming a localized infection that may lead to primary infection of TB. On the next stage, T lymphocyte is signaled to the site of the infection after 3 weeks to form a granuloma. Traditionally, granuloma act as a protective mechanism by preventing the spread of TB. However, granuloma can promote the proliferation of TB, therefore spreading it and influences the progression of the disease. After that, caseous necrosis takes place where the tissue in the middle of the granuloma dies, forming a soft white cheese-like necrosis. It acts by initiating activated T lymphocytes to destroy the macrophages that have been infected. This may lead to the damage of the tissue that may result in pulmonary lesion that is also known as gone focus. TB is able to spread into the hilar lymph node through the lymph or by direct extension from the gone focus. These 2 affected areas are called gone complex that can lead to fibrosis and calcification, forming a scar tissue that can be seen on the X-ray during the diagnosis. However, in immunocompetent individuals such as AIDS or aging, TB may be reactivated and spread, leading to systemic miliary TB. Systemic miliary TB causing the pathogens to spread to the other organs like kidney, meningitis of the brain, lumbar vertebrae, adrenal glands, liver, and cervical lymph node, making the infection more complex and difficult to be treated. The symptoms of TB include fever, fatigue, loss of weight, persistent cough that is associated with hemoptysis, and night sweats.
Okay, so for the treatment of tuberculosis, especially for Mycobacterium tuberculosis, this disease could be treated with isoniazid because of the drug's high selectivity as well as its potency and efficiency against the bacteria. Isoniazid is also considered as the first-line treatment for TB. This drug acts on the bacteria by binding to the nicotinamide adenine dinucleotide (NAD) and forming isoniazid nicotinamide adenine dinucleotide (INH-NADH) adducts, thus blocking the nucleic acid and lipid biosynthesis enzymes. This is because the INH-NAD adducts are possible competitive inhibitors of the enol acyl carrier protein reductase, which is an enzyme essential for the production of mycolic acids and mycobacterial cell walls. However, this drug may cause liver toxicity and other side effects such as peripheral neuropathy, rash, hepatitis, psychotic disease, seizure, and also CNS simulation. Okay, next, another first-line anti-TB agent is ethambutol. However, even though ethambutol is effective against M. tuberculosis strains, it is not very effective against other pathogens such as fungi, bacteria, or other viruses. Therefore, it should be taken in conjunction with at least one additional anti-tuberculosis medication such as isoniazid, streptomycin, or cyclosporin, and not on its own. Ethambutol does not kill the bacteria. Therefore, it is classified as a bacteriostatic agent because it only inhibits the growth of the bacteria by interfering with the production of arabinogalactan in the cell wall. Most of ethambutol's side effects involve the ocular system, such as loss of visual acuity in the form of optic neuritis, peripheral neuropathy, hepatotoxicity, mental confusion, potential hallucinations, as well as psychosis.
So, the next medication is rifampin, or also known as rifampicin in Europe. It is one of the first-line agents in the treatment of tuberculosis. Rifampin has wider antimicrobial activity than isoniazid. Usually, it will be used in combination with other anti-tubercular drugs. For the first 2 months, it will be used with isoniazid, ethambutol, and pyrazinamide. And for another 4 months, the patient will only need to administer rifampin with isoniazid. Rifampin provides bactericidal activity and works by suppressing the RNA synthesis. This medication is contraindicated to the patient with acute porphyrias and jaundice. Side effects such as nausea, vomiting, and thrombocytopenia may occur after the patient taking this medication. The next drug is pyrazinamide. This drug has the ability to shorten drug therapy and reduce disease relapse rates. Usually, it will be used in the initial phase in the treatment of tuberculosis. This drug has the ability to lower the environment pH, which is not suitable for the growth of Mycobacterium tuberculosis. Pyrazinamide is contraindicated in adult patients with acute attack of gout, and it needs to be used with caution among diabetes and gout patients. When taking this medication, patient may experience appetite decrease, nausea, vomiting, hepatic disorder, and malaise. However, if they experience persistent side effects, they are advised to discontinue this medication and seek for further information with the doctor immediately. If patient cannot tolerate the first-line drugs or patient who are infected with mycobacteria that are resistant to the first-line agents, the doctor need to change their medications to the second-line agents such as capreomycin and fluoroquinolones. I think that is all from our group. Thank you.